Good morning, guys. Welcome back to the Huntline. I wanted to go over a little bit of a new topic today. I don't have a case to show you. Should have prepared one, but what I wanted to talk about was a little bit of the philosophy of our implant consults. So many times, patients come in and they are missing several teeth. They've got, decay, gum disease, lots of problems, broken teeth, missing teeth and whatnot. And they say, I said, what are your goals? What are you trying to accomplish with this dental treatment? And they say, I'm just here to hear whatever you got to say, doc. And that's great that patients are able to put that kind of trust in me. But when I first got into this, I realized pretty quickly that I needed a way to prescribe an option for a patient, because we've got several different options and certainly they come at different price points. So I developed a philosophy in the practice where, I'm kind of a minimalistic guy, and I felt like, the patients really wanted chewing ability and to eat that steak more than anything. So, I've developed a philosophy where if we could provide them a prosthetic that would improve their chewing ability for the least amount of money, basically became the philosophy of the practice. So anytime a patient comes in, don't be surprised when I talk to you on the phone or I see you in the office and I say, how good can you chew right now today? Another question I love to ask patients is, do you go to a restaurant and choose what you want to eat, or do you choose what you can eat? Because those are good determining factors in getting an idea of what a patient's functionality is and how that's affecting their quality of life. So I wanted to go over kind of our entry-level implant option. So many times, this is the most common thing we do. We keep innovating, and I'm going to show a video on a new prosthetic that we're designing right now that I feel like is really a significant improvement on our roundhouse we've been doing for the last few years. But so many times, the entry-level implant option is that option that improves their chewing ability significantly. It makes their smile something they can be proud of again, and ultimately it makes this to where the price point to get into this is just really attainable. So what you're doing when you're doing what we call a special, this is implants on the lower denture. Okay, we're going to make you an upper and a lower denture, and we're going to put implants into the lower jaw. So you're going to get all your teeth removed. We're going to get all the infection out and make everything heal up and be happier. The smile is completely transformed with new upper and lower teeth. You're wearing a conventional denture on the top, just a regular denture that suctions onto the palate. And you're wearing a what we call an over denture on the bottom. And that's something where you have multiple teeth, obviously removed, but then you have these pins placed into the lower jaw, and these are mini implants. I actually traditionally do this on conventional implants, but I had a model showing you this. And then you can see these female attachments embedded inside the denture here. This actually snaps together, holding that denture down. Okay, the more implants you get, the better, because you don't get a little bit of mobility and float in the back of the denture. But this is an option that you can do really affordably. We consistently do this for under $10,000. I don't remember the last time I charged more than that for this. I've done this, depending on the patient's anatomy, for as low as $4,000 or $5,000 all the way up to $10,000. So, this is a price point that is really an attainable option for people to have a cosmetically completely transformed, all the infection out. They don't have any risk that they're going to have heart problems from gum disease. They can chew and smile with confidence and pride like they haven't been able to in years. So check out the special option, ask us about that. It's our entry-level implant package, and even today with all these new little innovations we're doing, this is the bread and butter of the practice. This is what we do for people very, very commonly, and then we build it to where you can upgrade to other prosthetics from there if you choose to in the future. Thanks guys, thanks for watching.